We first heard about this a couple of days ago. There is at least one new strain of coronavirus and perhaps as many as 5 other mutations. So what does this mean for the new vaccines? Health reporter Benita Zine joins us now with more. Benita.
Elaine, it was bound to happen because that's what viruses do. They mutate. And the first mutated version of the coronavirus was identified in the United Kingdom. And it's spreading faster than the coronavirus we've already been dealing with. An assistant professor at RPI explains what this means going forward.
And remember, when they adapt, really nature doesn't want them to become worse. They want them to become more transmissive.
And that's just what we're seeing with the SARS-CoV-2 virus, the virus responsible for COVID-19.
But over time, viruses kind of optimize for their host.
Meaning they don't become more deadly, because that would spell the end of the virus. But in this case, because it's spreading faster, it could claim more lives as more people at risk of serious complications could become infected. And as RPI Assistant Professor of Chemical and Biological Engineering, Dr. Jonathan Dordick explains, it's believed the mutation in the United Kingdom happened in a high-risk population, people who are immune compromised.
Immunocompromised patients have a large amount of virus that they can't clear. And so the virus stays in the host for a long time, and lots of mutations develop over that time.
The changes at this point won't affect the vaccine, says Dordick, because of how the vaccine was created. And even if there's a big enough viral shift down the road, he says the vaccine could easily be updated. SARS-CoV-2, responsible for this pandemic, is the 7th known coronavirus. 4 cause the common cold. 2 other coronaviruses, MERS and SARS, never became pandemic, he says, because they're only transmissible when a person is symptomatic, a kind of warning to stay away from others.
The challenge is that so many people are transmissive either asymptomatically or pre-symptomatically. And that's always a concern, because how do you know if you're going to potentially spread?
Making the need for the vaccine that much more valuable. And while the UK mutation is getting all the press, as Elaine mentioned, it's believed there may be as many as 5 other mutations already circulating.